This is LiveWell Talk on lifestyle factors and mental health. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health, St. Luke's Hospital. Diet, exercise, sleep, and social connections can all have an impact on our mental health. Joining me today to discuss this is Kate Jarvis, a psychiatrist with AbbeHealth, who will share how on a day-to-day basis we can make choices that affect our mental health from a well-being standpoint. Welcome. First podcast.
Yes, it is. Thank you.
So why psychiatry?
So in medical school and when I got in, I always thought I was going to be a family medicine physician. Started meeting patients and I just saw what a need mental health care was for a lot of patients and the impact it had on their overall health. And so I couldn't make up my mind, so I actually do both.
Yeah,
I do psychiatry and family medicine.
You and Dr. Donovan are both
Yes, yep, we are.
FP Psych.
Right? Yes. So, I've enjoyed that journey very much, and I can tell how it affects my patients from both sides.
How long have you been at AbbeHealth?
For about a year now. It'll be a year in July.
And where are you from?
Originally from just outside the Galena, Illinois area. Grew up on a dairy farm up there. And then did my medical training at the University of Illinois, my residency down at the University of Iowa. And then Dr. Donovan recruited me up to work with her.
Okay.
Yeah.
She wouldn't have trained at the same time you did.
Not at the same time, nope, but the
closer
same
to
program,
mine.
Yeah.
No, Jennifer's super smart. She's a good colleague to have. So, well, some of this stuff is just kind of bread and butter, but we don't do it on a regular basis, right?
Right.
Diet, sleep, exercise. How does that influence mental health, and maybe give people more of a background of why it's so important?
Yeah, absolutely. We're doing more and more research to figure out what is exactly going on in the brain when our body is exposed to these things, right? When it's exposed to a high-fat diet for a long time, lots of sugars in our diet. And we're finding that there's more and more markers of inflammation that are happening in the brain. So without getting into the cytokines and all of that, but we do know that long-term these exposures are changing the circuitry, changing the way our brain works. And that kind of leads to depression, anxiety. We're finding in the mouse models, there's the same markers of inflammatory markers in obesity and depression and anxiety.
So it's an inflammatory state.
Yes, absolutely. It's changing the way our brain connects, depleting serotonin, and all of those things. So it really is a physiologic process that's happening in the brain.
The longer I'm in practice, I think we have started to find the common link between a lot of illnesses, inflammation.
Mm-hmm. Absolutely.
Even go back to the cholesterol studies that maybe the statin drugs have an anti-inflammatory on the plaque, and it's not necessarily the cholesterol level itself.
Right. Yeah.
What is the biggest challenge people have to I mean, you're never going to regret not overeating.
Mm-hmm.
You're never going to regret going to bed early.
Right.
So why don't we?
I think it's life, right? There is so much on our plate all the time, and we have so much pressure on ourselves and from the outside to do the best thing. But I think a lot of times we try to take on too much at one time. I tell my patients that this lifestyle change we're looking for, it isn't, your fad diet. It's a slow change. So working towards one goal a week. So this week, going to set that alarm, go to bed at 10 o'clock every night, and just work on one thing every week that you can do to improve your health. I tell my patients I'd rather have them active than skinny. There's more studies too about activity, just getting off the couch, getting moving more than what they usually do. So not looking for them to get out and run marathons, but just being active and kind of from there it'll fuel their body to feel better.
And I think that's, if you're 400 pounds, you may get off your diabetic meds just by getting down to 350. You're still overweight.
Yeah.
But your thermostat is at a certain point, and everybody's thermostat's a little bit different. You start to see that benefit.
Yeah.
I think sleep is the knits the raveled sleeve of life, I think is the quote from Macbeth. But it's so hard to get a full night's sleep.
Mm-hmm.
And we know better. It's kind of like that old Seinfeld skit where he's like, oh, morning Dustin can worry about that. Nighttime Dustin wants to watch this movie or go out. You know, have you ever seen that skit? So, so you encourage your patients to take small steps.
Yes.
And try to reestablish that.
Yes, absolutely. So especially with sleep, having a consistent routine. We all have our smartphones on us, so using them for strategies to help. So set an alarm that say, hey, it's bedtime. So it interrupts you while you're watching your show, or so that you remember, hey, it's time to start winding down, shut off the TV, get my brain ready for that restful night's sleep. Yep. Only using the bedroom for sleep, kind of staying out of the bed all day. Lots of different strategies we talk about, especially for sleep.
Yeah, I as I've gotten older, it's certainly easier to fall asleep.
Yeah.
You know, I just don't go to bed at the right time, unfortunately. You know, there's two types of patient relationships with their physician. There's a paternal, where they just want to be told what to do, and you know, give them the meds, they'll take it, they'll see in so many months. Then there's others where it's fraternal, where they want to make that decision with you. Mm-hmm. What's your experience as far as patients motivate? Are your patients, how do I say this? Are your patients engaged that they're like, okay, I want to make these decisions together? What's been your experience as a young physician?
Yeah. I try to be upfront with my patients and say that my style is to make a decision together. And so I like to at least put a couple options on the table, you know, options I both agree with. And so typically when it's especially like starting a depression or anxiety medication, I talk about the different options available, because we have a lot of them, and try to make that decision together about what might be the best medication for them. And I feel like that really helps them know that I'm thinking about a lot of different factors, that the medications work a little bit differently. And I feel like it empowers them too to make that decision for them. Also helps them know that if this wasn't the right option, there are other options available out there, and we'll work together on figuring out what that best option is.
We'll get a little bit in the weeds on this one, just because part of my own curiosity. I've asked others. Yeah, within the last year, I think it was, where they said SSRIs may not work like we thought they did for depression. I'm sure you saw that. I'm sure you're well versed in this literature. But if that's the case, then how come patients do better on them?
Yeah.
So what's your experience in your practice? I know I'm kind of going off the topic here, but
no,
this is
absolutely. I don't think I've read the specific article you're talking about, but I do know that the data does not show that these medicines are super fantastic to treat patients. I do still have a lot of patients that benefit from them.
That's been my experience too.
Yeah, so I do still think that there is some benefit adjusting, increasing the serotonin in the brain for these diagnoses, for sure. In the future, if we kind of go to a different mechanism, that will be really exciting to be there and see what we do. But I'm still offer them, prescribe them, counsel patients on using them.
I kind of reading this study and some of the editorials, it might be the fact that they're overprescribed, and then so you're treating people that don't benefit because they didn't need them. That maybe just simple lifestyle modification, et cetera, could have kind of snapped them out of whatever funk they were in. So, I used to scoff at it when they would say, I have a lot of stress in my life, and that's why, did stress cause this? But as I've gotten older and farther along my practice, stress does play a big part in this. And in this society, we talk about stress management, which is kind of an odd phrase, right? Because, you manage your farm, you manage a family, you manage a business. So it's almost like we accept that. To me, the phrase stress management is accepting the fact you're going to have stress, right?
Sure.
Rather than encouraging us to say, I'm not going to have stress because this doesn't matter. right?
Right.
Kind of like a stoic sort of attitude.
Yeah.
But instead we approach it with, well, I'm going to have the stress in my life, so I must learn how to manage it. So how do you empower patients to address stress?
Yeah. So I usually talk about kind of the glass full of water. And so we always have life filling up our glass, right? But it's those things that to manage stress is so that we're kind of emptying the glass so there's room for that so we don't flow all over the table. And so, things like exercising, going for a walk, hobbies, listening to music, those types of things are all things that kind of take that little bit of that extra out of the glass so that we have room for more. It's kind of the way I explain it to patients and kind of to help them see like, yeah, the glass of life will still be continuing to fill each and every day, but how do I make sure there's room?
I mean, yeah, it's just, it's perplexing, isn't it? We all know that let's just start with the fact we all know that we're all going to die, right?
Mm-hmm.
So what the worst thing that possibly could happen to us is something that we all know is going to happen.
Yeah.
Right? But yeah, we get so stressed about stuff and it's real.
Mm-hmm.
And it does influence people's health.
Mm-hmm.
It does.
Yeah.
Absolutely. I didn't always believe that when I was younger. Just kind of growing up in the typical Midwestern household, you don't talk about stress and pull your bootstraps up and go work and, et cetera. But it does. Mm-hmm. And I think effective ways to manage that is healthy ways to manage that. Mm-hmm. You can make your stress go away by, drinking a bottle of whiskey. It'll still be there when you sober up, but, you've been detrimental to your health, of course. Yeah. Have you seen... So, I mean, you're young in your career. Have you seen the pandemic's influence on patients? What's been your experience in your practice?
Yeah, I think that the pandemic changed just so much for everybody. Like a whole new set of kind of worries and anxiety just kind of opened that way. There's been some positives. People have been at home more to interact with family more, but also it has just been an incredibly stressful time of dealing with the unknown. I think it's been a big factor of things were so outside of our control, right? We didn't have the information. We couldn't know what to do next or what. And so building kind of comfortable, just dealing with the stress of the unknown was a big thing that I've seen. And so how are we gonna manage that stress of the unknown was a big thing that we talked about a lot. Yeah.
Interesting.
Yeah.
If you could give one piece of advice to someone that has a lot of stress in their life,
mm-hmm.
perceived stress real, it's real to them.
Oh yeah, no, it's real.
I mean, you might observe outside and say, well, that doesn't appear to be stress. Well, stress is something we measure ourselves, I guess. What's your one piece of advice that you give to patients? I mean, if you could. One thing for someone, I like to do this to people, so don't feel like I'm picking on you. If you could meet someone at their front door as they're going out for the day and they have stress, what would you say? Hey, this is the one piece of advice I want you to follow today. What would you tell them?
Yeah, I think I was telling myself on the way here, I felt like I had so much to do today. I got to do this. And it's just to slow down, take a breath, you'll get everything done. It'll happen the way it's meant to happen. And that there's no reason to kind of to rush through it. To just, we talk a little bit about mindfulness sometimes if I have time with a patient, of just being in the moment instead of just rushing through the day to get to the next day to rush through it. It's just slow down.
Yeah.
Slow down. Yeah.
Unless it's trash day, then I got to get the trash cans out on time.
Yes, unless it's trash day.
Yeah, then you're stressed. That's stress.
Yeah.
Because you can't put it out the night before because our neighborhood has these really huge raccoons that just get bigger every week because people put their garbage out the night before. So that's another podcast. What warning factors should family members pick up on if their loved one might not be doing the best mental health stress-wise? Mm-hmm. What is something that I mean, I'm going to notice some obvious changes, right? But what are some things that make you perk up and listen?
Right. Especially so if people aren't enjoying kind of what they used to enjoy.
Okay.
If they're used to enjoy a walk in the evening, or now they're just saying, I don't really feel like it. If they're withdrawing to their home, staying home, or staying more in their room, I think that is kind of that first sign that we first kind of distance ourselves, especially socially, when something is up. And could be a brain break, but also just a reason to pay attention and be there to listen, and just say that, hey, I'm here if something's going on. But also, just watching, making sure the patient somebody isn't drinking more, using more tobacco, using other dangerous substances. That can be a sign too that someone's mental health isn't doing well.
Self-medicating.
Right, exactly. So watching for some of that could be early signs too.
Okay.
Yeah.
If someone needs to get into the Abbe Center for mental health, how does that happen?
Yeah, so we have same-day access, usually about every morning. Some of the hours vary, but you can walk in, and our intake department will meet with you, figure out what services you need, what can we help you with, and then from there, they're great about setting up appointments with myself or with one of our nurse practitioners or Dr. Donovan, or setting up a family medicine appointment with Dr. Donovan or myself, or therapy, or the other services that the Abbe Center can offer too.
That's outstanding.
Yep.
Yeah, I don't think listeners will appreciate that, being, whether it's internal medicine or family medicine and psychiatry, that what a valuable colleague you guys are to the rest of us as far as a team member. Dr. Donovan, she used to be with the residency, and I would do the inpatient service, and learned so much from her just to how to incorporate these really complex medical patients with mental illness. I learned a lot from Jennifer, and I'm sure you're learning a lot from her as well.
Oh, absolutely. She's been a fantastic mentor.
Dr. Jarvis, thank you again for joining me today and educating us on mental health can be influenced by our physical health and habits. AbbeHealth offers mental health services across the several locations throughout eastern Iowa. To find the location closest to you, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.